Okay, now you can hear. Is it audible? Yes? Yes. So today's topic is total leukocyte count. Last class we have done anemia. उसका जो tidbit part जो छूटा है that you have to complete, because we'll linger on this particular topic, then it will not be able for us to complete the whole topic. So today we'll start with total leukocyte count or leukocyte specifically, and for leukocyte we have to study in theory as well as in practical. So when we'll do it in practical, this week we'll do total leukocyte count. Clear? You might be having the idea about the different types of WBCs. Okay, so what are the two main categories or divisions of WBCs? It is not a group viva, or we are not doing a small group discussion. Clear? So the person who is asked, that only has to answer. Okay, so when we are talking of WBC, what are the requirements, why it is essential? Okay, so they are the important source or the mechanism provided by the human fight against foreign invading organism, maybe antigen, maybe virus, bacteria, any pathogenic causative agent. Okay, so the body has its own protective mechanism. This protective mechanism is brought about with the help of WBCs or leukocytes. When we study the leukocytes in practical class, when we are doing total leukocyte count, we are not concerned with its different divisions or types. Clear? So we should have a basic idea. So the normal range of total leukocyte count, when we are doing it, it is 4,000 cells to 11,000 cells. Complete the unit, cells per cubic millimeter of blood. Clear? Now the skin itself is the biggest defense mechanism provided by the body. Okay, when we are talking of the different causative agents, pathogenic, okay, antigens, they have the different routes that can give rise, they can enter into the body. So the different type of protective mechanism given by the body may be with the help of granulocytes and monocytes and lymphocytes. Okay, but broadly the two main defense mechanism is by phagocytosis or by providing immunity. Clear? So in this particular class we'll talking about the phagocytosis. Another separate section will be taken related to immunity. Okay, so in this class we'll deal with granulocytes. What are the different types of granulocytes? Just listen. What will be the objective of today's class? If time does not permit, then at least we should know this much in this particular class. Okay, what are the different types of granulocytes? What is their formation step by step? That was erythropoiesis, so it will be leukopoiesis. Okay, their lifespan and mechanism, how they act against the particular antigen or the disease causing agent. Clear? We'll try to cover this much, and in the later section we'll try to cover the reticuloendothelial system in the later section of this particular topic. Okay, so the white cells, okay, mediate response that destroy or neutralizes the specific microorganism. Okay, circulate in blood and may enter the tissues. The site of formation of WBCs is in bone marrow. As we remember, the pluripotent hemopoietic stem cells, that is the main source for forming the blood cells. But this line again divides into erythroid series, granulocyte and monocyte series. Okay, one line separates, that is the lymphoid series, that was responsible for the formation of lymphocytes that takes place in the different areas of the body. Okay, so these are the three series. Out of 6 types, generally in GK PAL or AK Jain, you might see that the WBCs are classified into 5 types. No need to get confused, इतना बहुत major वो नहीं है. Generally जो अपन बोलते हैं 5 types of WBCs. The exceptional one is the plasma cell. Okay, that is added into this. Out of 6 types, polymorphonuclear. Polymorphonuclear means the nucleus is 2 or more than 2 lobes. It is not always that it will be multi-lobed. When it comes for identification, generally a student says that it is multi-lobed. It is not always multi-lobed, but it might have two or more than two lobes. Okay, poly means many, but it might start from two. So polymorphonuclear. Okay, morphology of the nucleus: neutrophil, eosinophil, and basophil. Okay, monocyte and lymphocyte. These three particular cells, they fall under the category of granulocytes. Why we are calling it as granulocytes? Granules present होते हैं. So how will you come to know that these granules are present in this particular type of cells? Was done or studied by Romanowski. Okay, and with the help of this particular stain, he was able to identify the different types of WBCs. Okay, on the basis of the content of the stain. So when we will do DLC or the differential leukocyte count, then we will use this particular type of stain. Okay, in our laboratories we use Leishman stain. So it has a particular composition that gives colors to these granules. So with the help of this particular color, we will be able to identify whether the cell falls under neutrophil, eosinophil, or basophil. General categorization is that these three cells, they fall under the category of granulocytes. This is a general term or a general answer which a student gives. But the question जो आता है वो हमारा आता है कि you have to be very much specific about which granulocyte. Okay, so the composition or the content of each granule is such a chemical combination that it is responsible for specific functions. Okay, eosinophil के जो granules का content है और जो उसका appearance है वो उसका एक important function perform करता है parasitic infestation, because it does not have a major role in phagocytosis. Okay, so on basis of the appearance of the granules, okay, so in case of neutrophils, the granules take both the type of stains, acidic as well as basic stains. So they appearish as bluish and pinkish in appearance. दोनों कलर का stain लेते हैं, and they appear as fine dust particles, very fine. That is the most differentiating feature of neutrophil. Another important differentiating feature is it has 2 to 7 lobed nucleus. But it is not mandatory that all the nucleus will have 2 or more than 2 nucleus. The immature stage of neutrophil has a band-shaped appearance nucleus, so it might appear as a single nucleus also. But as the cell matures, the number of division of the nucleus increases. Okay, so if a band-shaped neutrophil is present, then it is a younger neutrophil. If it is 3-lobed, it is a mature neutrophil. Okay, on the basis of study of these particular divisions of the nucleus, a study is done that is known as Arnett count. On the basis of this particular study, the person's diagnosis can be done. That is the activity of the bone marrow. Which type of cells are present more in number, young or mature? So on the basis of the study of this particular lobe, N1 means single lobe nucleus, N2 means double lobe nucleus, N3 means triple lobe nucleus. तो अपन केवल न्यूट्रोफिल्स की स्टडी वो भी किस बेसिस पे कर रहे हैं? न्यूक्लियस के बेसिस पे. उस स्टडी को बोलते हैं आर्नेट काउंट. ARNETH, Arnett count. When you appear for leukocytes in your practical classes this week, when you will be dealing with total leukocyte count, तब हमें leukocytes कैसे दिखेंगे माइक्रोस्कोप पे? They will appear as a shiny body. They will have a refractile membrane. Okay, you will be counting these WBCs under 10x with constant use of fine adjustment screw. Until unless you will use fine adjustment screw, that is the racking mechanism. जब भी अपन TLC करते हैं ना, तो अपना एक हाथ definitely fine adjustment screw पे रहता है to make sure that the cell which we are counting is a WBC. Yeah? If there is a difference of one cell, then it will be creating a difference of 50. because the final calculating formula becomes n into 50. क्या हो रहा है आपस में? तो अगर एक भी सेल हमने ज्यादा या कम किया गिना तो कितने का डिफरेंस हो गया? 50 का. और नॉर्मल रेंज कितनी होती है? 4000 to 11,000 सेल्स पर क्यूबिक मिलीमीटर ऑफ ब्लड. ओके, एंड स्पेशली जब डीएलसी करेंगे 1-2 महीने बाद, तब हमें इसको याद रखना है, तब तक भूलना नहीं है इन चीजों को. ओके, so just go through. Next comes our eosinophil and basophil. Okay, so their appearance is quite different. Eosinophil is loving eosin stain, so the granules will be brick red in appearance and they will be coarse granules. Okay, the prominent feature of eosinophil is presence of coarse brick red color granules. Okay, and the nucleus will be spectacle shaped. Nucleus कैसा होगा? Bilobed हो गया. Bi means poly, spectacle shaped nucleus. Cytoplasm will have granules. Granules कैसे होंगे? Coarse. Coarse means they will be bigger in size compared to neutrophil. And what will be the color of the granules? It will be brick red in color. This all characters will depend on how you make your slide. Okay, the slide may be good, then the particular features will be seen. If it is not good, then it will not be possible for you to see it. ठीक है, तो ये skill का काम है अपना. Basophil, it is B for blue. So basophil will have the nucleus covered with blue color granules, and the granules will be coarse in appearance, bigger and coarse. Similar like eosinophil, but the color will be different. For eosinophil, it will be brick red. For basophil, it will be dark blue. So the basophil will appear as an ink spot. जैसे एक ink का spot हो जाता है, वैसे basophil का appearance रहता है, and the whole of the nucleus is obscure or covered with granules. Whereas in eosinophil, you can clearly see the spectacle shaped nucleus. In case of basophil, the nucleus is S-shaped, but the nucleus is covered with blue color coarse granules. Okay, monocyte falls under the category of agranulocytes. The nucleus is quite big. Okay, and the cytoplasmic content is also there. 2/3 and 1/3 is the ratio division of the nucleus and the cytoplasm. The nucleus is generally indented or horseshoe shaped nucleus. Okay, खड़े हो जाओ बच्चे, अगर पेंसिल का लेन देन हो गया हो तो खड़े हो जाओ. हाँ, आप दोनों खड़े हो जाओ. चेक शर्ट, खड़े हो जाओ. और नेक्स्ट आपके खड़े हो जाओ. हाँ, ओके. इतने इनोसेंट फेसेस हैं तो अपनी इनोसेंसी भी मेंटेन रखनी चाहिए अपने को. ठीक है. When we are talking of lymphocytes, okay, when we'll see it in differential leukocyte count or in blood film, these are your classmates. You will see them after 12 o'clock also, but these PPTs you will not be able to see after 12 or 1 o'clock. Okay. So please focus and try to complete the thing. So when we are talking of lymphocytes, please remember when we are doing it in blood film, the lymphocytes we divide it into small and large lymphocytes. When we will study immunity or the later section of WBCs, the lymphocyte will be divided into T and B lymphocytes. Clear? So these are the classification. Platelets, they are getting formed from the megakaryocytes. Average is 7,000 cells per cubic millimeter. Range was from 4,000 to 11,000 cells per cubic millimeter. Almost 1,000 folds fewer than RBC. So when you see blood film, out of 500 or 700, you will rarely see a WBC. Okay. Proportions is, this is what DLC stands for. DLC stands for differential leukocyte count, or the percentage by distribution of WBCs. Okay, so if we have counted 100 WBCs in a slide, so out of 100 WBCs, what will be the percentage-wise distribution of different WBCs? So the maximum number of cells will be neutrophil, then comes lymphocyte, then comes your monocyte, okay, then comes eosinophil, and last it will be basophil. Okay, this specially I took it from Guyton. तो इसकी जो percentage और जो value है वो standard है, ठीक है. इसके कम से कम भी इसके 4 practicals होंगे अपने hematology lab में, ठीक है. 4 तरह से ये पूछे जा सकते हैं. तो इनकी जो values हैं, जो units हैं, वो याद रखना. Clear? So neutrophil 62%. This is average. Okay, we have to focus on range also. Now leukopoiesis, that is formation of leukocytes. Myelocyte, okay, then comes your different stages: polymorphonuclear, neutrophil, this is eosinophil, okay, and basophil. This is genesis of lymphocytes, the categorization of different lymphocytes. This is band shaped neutrophil. जो बताया था ना, यंग जो न्यूट्रोफिल है जिसका कि न्यूक्लियस अब डिवाइड होगा, so this is band shaped neutrophil. Then this is eosinophil. You can see the granules, brick red color. Okay. Granulocytes and monocytes develop in bone marrow. Okay. Number in marrow is 3 times the blood, which is the number present in the circulation. Now this leukopoiesis takes place in bone marrow. There the formation taking place, from there the blood or the WBCs will enter into the circulatory pool. तो ये जो leukopoiesis होता है वो 3 pools में divide हो गया. एक हो गया marrow pool, ठीक है, एक circulatory pool, एक हो गया tissue pool. Okay. So when the formation takes place in the bone marrow, the cells, they are getting formed, okay. When they are getting formed in the bone marrow, they have to enter into the circulation. So when they enter into the circulation, the lifespan of WBC, okay, varies. When we are talking of neutrophil, okay, the lifespan is 4 to 6 hours when they are present in circulation. जब circulation में भी होते हैं ना, तो इनके 2 तरह के pool हो जाते हैं. एक होता है marginal pool. When we are talking of the vessels, okay, so some of the neutrophils or leukocytes, okay, they reside on the margin of the vessel, so that the WBCs which are present on the margin of the vessel, okay, that pool becomes marginal pool. Some of the WBCs or the neutrophils, they are present or they are circulating in the blood in the central or the laminar flow, okay, that becomes the circulating pool. ठीक है, तो बुक के अंदर आपको इसमें 3 pools दिखाई देंगे कि जो ल्यूकोपोइसिस है उसको हमने 3 pools में स्टडी किया है. तो फर्स्ट pool क्या हो गया, बोन मैरो. बोन मैरो के बाद में they will enter into the circulatory system. When they enters into the circulatory system, they are subdivided into marginal pool and the circulatory pools. From the circulation, they will enter into the tissue spaces, okay. Which cell will enter into the tissue spaces? The neutrophil and the monocytes. When the monocytes enter into the tissue spaces, okay, they become enlarged and now they become macrophage. When they become macrophage, the monocyte's lifespan increases to months or at times maybe years. Generally कितनी आती है? 4 to 6 hours. Clear? When they are present in the circulatory pool. But if some infection takes place, inflammation takes place, they have a role to play, so their lifespan will reduce. They will go to that targeted area of infection or inflammation, okay, and their lifespan will be shortened. So when you read the single line, the explanation is there. उसकी हर चीज का एक एक्सप्लेनेशन है, उसको हमें ल्यूकोपोइसिस में लिखना पड़ेगा, ओके. number in marrow is 3 times which are present in the circulating pool. Okay, that is supply कितने दिन की extra है? 6 day supply extra is present. Okay, lymphocytes develop mostly in the peripheral lymphoid organs like thymus, lymph nodes and Peyer's patches. Where they are present? They are present in the small intestine. Okay, so ये एक आपका MCQ बन जाता है specially. Yeah, megakaryocyte develop and resides in the marrow fragment to release platelets. We are not mainly concerned with platelets in today's class. Okay, granulocytes circulating, the lifespan is 4 to 8 hours in the tissue when they reaches granulocytes. ठीक है, study of granulocytes. We are not talking of monocytes. Granulocytes की जब बात करें तो circulating pool में 4 to 8 hours. When they present in the tissue, it is of 4 to 5 days. Shorter timeline with infection and inflammation. Okay, monocytes or macrophages. Circulating lifespan is 10 to 20 hours, and when they present in the tissue, months or maybe longer. Okay, lymphocytes continuously recirculate through the lymph nodes, long-lived, week, months or longer, because they are providing immunity, and the immunity may be cell-mediated, may be humoral type of immunity, and depending on the type and the lymphocyte which is creating the immunity, it may take longer lifespan. Okay, replaced every 10 days. In case of dengue, what happens is the requirement of platelets increases. If the patient count decreases below 50,000, then the need requires, okay, that need is to be compensated by fresh supply of blood. In blood bank we store blood, okay, but we need to emphasize on the blood compartments or the composition, which part has to be transfused. Is it whether the plasma or RBC or the platelets? Okay, whichever component is required. क्या हुआ बच्चे? भूखे पेट भी अच्छी नींद आ रही है? Okay. Neutrophils are mature cells that can respond immediately to infections. So, which cells are first line of defense? Which cells? The neutrophils. Another MCQ is first line of defense mechanism is provided by neutrophils. Okay. Monocytes mature in the tissue to become macrophage. They are also phagocytic in nature, but the first line of defense mechanism is provided by neutrophils. Now, both exhibit motility, and this motility is diapetesis. Okay, diapetesis when it has to come from marrow into the circulation. So, by which mechanism it is coming? It is coming through diapetesis. When it has to move into the tissues, the amoeboid type of movement. Okay, the एक पे MCQ है. अपने को हर एक चीज को टारगेट करके चलना है कि कोई आंसर अपने को कैसे देना है. Chemotaxis or chemoattractants, the bacterial or the tissue degradation products, complement fragments and other chemical mediators. Okay, so whatever the bacteria or the virus or antigen which has entered into the body, definitely it is going to secrete or release certain chemicals. These chemicals, when they are getting secreted or getting out from the antigen, they become the attracting force for the neutrophils, monocytes, or in general WBCs. Because of this chemical attraction, it is known as chemoattractants or chemotaxis. This is the mechanism of diapetesis, okay, and chemoattractant source. From the capillaries, they are getting out, okay, and when they are present in the tissues, the amoeboid type of movement. The important question which comes is, add a note on phagocytosis. So, last row, this is the difference. It seems that you have gone through these topics in your coaching class or in your 12th standard or anything, okay? But when it comes to writing in a medical college or your first year exam, it is not the pattern to write or give your answer. है ना? बोरिंग लगता है, अभी तो और बोरिंग लगेगा. This is just a beginning. All of you are going to feel that you know so much about it, but when it comes to writing or for viva purpose, it is a bit different and difficult. Okay? और कभी नींद आए ना तो खुद ही खड़े हो जाया करो क्लास में. That's the best thing. Now keep studying for 2 minutes, okay? So phagocytosis is the ingestion of particles. Must distinguish foreign particles from host tissue. What do you mean by this? In general, the function of the neutrophil is for phagocytosis, but it has to keep it in mind that it has not to kill the host organism or the host. So it has to identify self and non-self antigens. It has to identify that this particular antigen has to be phagocytosed or it has to be destroyed, and this particular cell is self. It is not non-self or the outer antigen. So for identification of this particular step, the 3 features which has to be kept in mind is that the thing which has to be phagocytosed, okay, need not to have a smooth surface. Okay, अगर किसी सेल को इसको phagocyte करना है तो उसका जो surface होगा, it will never be a smooth surface. Okay, this host cell or the host organism cells जो होते हैं वो क्या होंगे, उनके ऊपर एक protective coat होगा. Okay, and these things will be missing in the antigen. So with the help of these 2 basic things to keep in mind, that it will not be having a smooth surface, and that particular in some antigens the protective coat might be missing. Okay, and the complement system or the immunity system, they secrete C4 particles, C3 complement system. They will cover the antigen and make it tasty for the neutrophils or the phagocytic cells. The process known as opsonization. So these 3 things have to be kept in mind for the phagocytic activity or phagocytosis. ये जो ऑब्जर्वेशन शुरू होती है ना, ये अगले साल फरवरी तक चलेगी. And if you are not interested in listening the lecture, you may leave. इसलिए टाइम टेबल लगता है. If you are interested, you may enter, and if you have entered, maintain the discipline. Okay. May have rough surface, lack protective protein coat, may be immunologically marked for phagocytosis by antibodies or complement components. Okay, when we will be talking of B lymphocytes, they will be forming antibodies. There in immunity, you will be talking about the complement system. So the C3 complement system, they are there for recognition. So they will combine with the phagocytic receptors and will be resulting into opsonization, the important step for phagocytosis. This is known as opsonization. Okay. Difference between neutrophil and monocyte. The function of neutrophil is also phagocytosis and the function of monocyte is also phagocytosis. But the terminology for monocyte is macrophage. The difference lies in their lifespan. They can ingest 3 to 20 bacteria, okay, and they can ingest up to 100 bacteria. Okay. After being activated into tissue, they are extremely effective phagocytes. Another important question comes in your practical exam is, focus the cell which is responsible for the killing of the tuberculum bacteria. Okay. तो उसके लिए होता है मोनोसाइट. फैगोसिटिक एक्टिविटी तो दोनों ही कर रहे हैं, जैसे कि इसने बताया कि डाइजेस्टिव एंजाइम्स होते हैं, लाइसोसोम्स होते हैं जो कि रिलीज करेंगे, प्रोटियोलिटिक नेचर के होते हैं. ठीक है. But in certain antigens, this mechanism also fails. So there comes another important mechanism where the free radicals are getting regenerated. Okay, hydrogen peroxide, hydroxyl ions. Okay, when they react with chloride, they result into hypochlorite formation. This hypochlorite is strong bactericidal reagent or the chemical which will destroy the bacteria. But in case of tuberculum, the tuberculosis causing agent, the case is different, and there the lipase activity will take place. Okay, and this is particularly done with the help of monocyte. ठीक है, तो ये कहाँ पे काम में आएगा? This will come or help you in your solving of case study or problem solving questions. So you have to correlate it. Specifically, if a case is given you of tuberculosis, there the special emphasis will be given on the monocyte. There the differential leukocyte count value will be given to you. But for that you need to have the idea of the normal differential leukocyte count value. Okay. In case of lymphocyte, the lymphocyte count in children. Okay. जब अपन lymphocyte का देखेंगे DLC में, the relative lymphocytosis is the word, another term which is introduced. So if a problem based question comes, especially of this children or this age group, okay, then relative lymphocytosis, that is normally there is increase in the lymphocyte count in this age group of till 10 to 12 years. So the word becomes relative lymphocytosis. These are your 15 or 10 mark questions, but you have to relate it.